Welcome to Healthy Frontiers. My name is Dr. Bizzoni, and this show is dedicated to the education of our viewers. Tonight's topic is holistic dermatology. My special guest is Dr. Alan Dattner, MD. Dr. Dattner is a pioneer in the field of natural skin care, natural acne treatment, and holistic dermatology. Dr. Dattner has been developing unique individual solutions with patients for hard-to-treat skin and inflammation or disorders for the past 30 years. He's a founder of the Holistic Dermatology and Integrative Medicine with offices in New York City and New Rochelle, New York. His 40-year career credentials include former visiting scientist for the dermatology branch of the National Cancer Institute. He's a board-certified dermatologist. He's a fellow of the American Academy of Dermatology, founding member first AAD Task Force on Nutrition and Evaluation of Alternative Medicine. He's also a member of the Advisory Board for Dermatology for the American Botanical Council, and he is the author of the first textbook chapter on complementary and alternative medicine in dermatology, Fitzpatrick's Dermatology and General Medicine. Welcome, Doc.
Thank you very much.
Great to have you on the show.
Thank you.
Doc, you've written a book recently. It's just come out. I know it's been a long, arduous task, but here it's terrific. So why don't you tell us why you wrote it, what's in it, and why you're excited about bringing it out.
Okay, thank you very much.
Yeah.
Well, this is the book,
Yes.
Radiant Skin from the Inside Out,
Right.
The Holistic Dermatologist's Guide to Healing Skin Naturally.
Right.
And you can get it on Amazon. It should be available very shortly.
Okay.
And the book is really a blueprint of how to take care of the skin in with natural methods, as opposed to what is more conventionally used by dermatologists. So instead of just treating the end process, stopping the inflammation with a steroid or a biologic, this book talks about how you get to the basis of what's causing the problem. Correct. And reverse that.
Yes.
And this gives a whole outline of the immunology behind this, so that when you're reading a blog or you're hearing a story about somebody's cure of an inflammatory condition or of a skin disease, you have an understanding of what the parameters are that might have made that work, rather than just blindly saying, okay, this condition gets better with a gluten-free or a this or that, a caveman diet. Correct. So it helps people find the pathway that's most exactly useful for them.
Perfect. And so who might best benefit from the book, Doc?
Well, anybody with a skin disorder is going to benefit if they're interested in finding other ways of solving the problem. Right. Or of getting better control in using something in addition to what their dermatologist is giving them. Right. And the people who are going to benefit most are the ones also who want to use natural methods and are willing to make the changes necessary to do that. That's great.
So what is a holistic dermatologist?
Well,
now, we can go on forever. Go ahead.
Okay. There are a couple of things that are involved in holistic dermatology. One is I'm a dermatologist, so I understand the methods that are available and what the positives and negatives are. I understand the biology and physiology of the skin, so I bring that to the table. And at the same time, I have other methods to use that get back to the etiology, to the root cause of the problem that's going on. And the root cause is usually an environmental exposure, whether it's something topical, which my colleagues are very good at diagnosing, if it's a contact sensitivity. But the biggest source of foreign material entering the body is through the mouth. So the digestive tract is what I spend a lot of time correcting. The microbiome, the digestion, leaky gut, all of those things are things that I address in my practice. The other thing is that holistic dermatology covers a wide variety of inputs. So some people have an emotional issue, which leads to an eating issue, which leads to a gut issue, which leads to a skin issue. So when it becomes obvious that there's a particular area that needs treatment, I address that area. The other thing is it's very eclectic. So I use a number of different techniques that are not in conventional medicine. Those include herbology, those include some chiropractic techniques like
perfect, right?
applied kinesiology to give
Yes.
me further information that corresponds with what I've learned from history and physical as well, and helps me better select among the things that intellectually should make sense for, say, treating the digestive issues. I can refine that using the applied kinesiology.
That's great. That's great. So, why did you choose to practice that way?
Well, you know, I got to the tip of the tip in terms of practice of dermatology, and I saw what was known and what wasn't known. The tip of the tip, this was the National Institute of Health, Building 10, where we flew patients in who we wanted to study from all over the country.
Yes.
And we had patients there who had rare disorders that were being treated with vitamin C, but there was not an understanding of the lore around vitamin C and bioflavonoids.
Right.
And I realized I had to go outside of current conventional medicine to bring in the totality of knowledge that was available. And so it was very exciting when I found out that all this was available through the what was called the alternative world then. But interestingly, in this particular case with the vitamin C, the work on bioflavonoids had been done in the 50s by a Nobel Prize winner. So it had just left medicine for a while. It wasn't that it was never in it.
Right, okay. Sure, it was always there.
Yeah.
Good. So how do you look at skin disease differently from your colleagues in dermatology?
Well, you know, if you pick up a textbook in dermatology, you look at it and you read about this disorder and they say this might be related to ticks, it might be related to this, but we don't know the answer.
Right.
Well, that's what got me. I said, I want to know the answer. What's causing it? And when I finished my work at the dermatology branch, we had done work on what was known as immune recognition. How the white cells, not the antibodies, but the white cells see one thing and have it look like another. They see this flower and say, oh, that looks like that one, and they attack. If they're sensitive to this, they attack the other one.
Yeah.
And that turns out to be an equation that requires not only the flower, but the hand that's holding the flower, if you will.
Sure.
It's the transplantation antigens. And we showed that, and actually later 2 people won Nobel Prizes on work related to that.
Wow, for that research, that's terrific.
So that made me understand that there were very unique equations that went on. So it wasn't one, you know, like that corn caused eczema. It was corn in a certain person's system that would cause a cross reaction to their own skin, and maybe even at certain times. So I began to see that these kinds of things really existed, and it let me know that the kinds of things I was hearing from the alternative world made sense.
Yeah. It's like, why would you have that allergy and I don't?
Right.
I mean,
exactly.
It boils down, it's as simple as that. Sometimes it's like, let's find out why this guy has it and this guy doesn't.
Yeah, and it's because of this this additional piece for the recognition. Plus the exposure. There are a lot of different variables, and a lot of this had gotten thrown out because they said, well, if eczema is caused by corn, then all eczema should be caused by corn, but it isn't, and not even in the same individual. So they threw out the food thing because it didn't make sense. It's only with this new perspective that it makes sense. So as I saw that, and as I began to do it, I began to find solutions for people who hadn't found solutions before, and I became very excited. Not just that I wanted to help those people, but I wanted to bring this knowledge into medicine, not just for skin, because it's of course important for skin, but for inflammation in general.
Sure, makes so much sense. So what are some examples of techniques you might apply that differ?
Well, as I was saying before, I use muscle response testing. I was fortunate to have some sessions with George Goodhart. With
me too. I love it.
Yeah, with David Leaf, and especially with Bill Makel up in Auburn, who taught one of the 100-hour courses, and I took that, and after I did that, I was able to do things I couldn't have done before with just intermittent exposure to that. So that has been very helpful. I use various forms of tongue diagnosis with more of a Chinese perspective. I have picked up a lot of different little pieces along the way that kind of fill in so that I get information. I would say I get what we would call in medicine soft information in a number of different ways. But when you smell smoke and you see a little flame, you know, you may not put your hand in the fire, but you begin to say, I think there's fire there.
So, there you go, perfect.
So all that putting all these different things together,
Mm-hmm.
and always there's more. With functional medicine, I was
Mm-hmm.
with Jeff Bland 30 years ago,
Great.
and
Great man.
yeah, so I've been following that, and now I have an assistant who's studying Ayurvedic medicine.
Mm-hmm.
So we bring that perspective in. Each thing gives you a little twist that helps you better point a person in a direction that's going to be better for them in
Right.
subtle ways. Like
Mm-hmm.
a lot of people with skin disease, they're more vata, they're more airy, and
Yeah.
they need to be more grounded. And they might be eating raw food, and that's not good for them. They might need to have cooked food instead if they're more vata.
For
So
sure.
all of these little perspectives add together to give a greater whole.
Great. That's great. So insightful. So, give us an example of how you would treat acne as a conventional dermatologist as compared with methods that you would employ.
Well, as a conventional dermatologist, depending upon the severity of the acne, I might just use some topical retinoids or antibiotics or benzoyl peroxide to open up the plugs, to calm down any infection in the area. If it's worse, I'd go to antibiotics, and if
Mm-hmm.
it's worse, I might even go to retinoids,
Yeah.
oral retinoids.
Okay.
In my practice, I did a little of those things before I started doing more alternative things, but I
Yes.
began to see some problems with people who had been to dermatologists and been on antibiotics for a long time and started developing
Yeah.
yeast and chronic fatigue and various problems.
Sure.
So as a holistic dermatologist, I work on the digestive tract. I try to get the organisms more normalized.
Mm-hmm.
I try to enhance the digestion. I fix leaky gut if there's inflammation that's caused that, um, and and fix the liver
Yeah.
and until I've gotten to the
Yeah.
skin, and then I'll help with drainage products to help the skin.
Right. And then the skin's going to react.
Yeah,
There you
and
go.
then I get a longer cure when
Yeah.
they've learned how to take care of themselves that
Sure.
way.
I mean, it's not just putting something on it. It's about getting rid of the cause of the problem and then them taking them on their own and following through, right? And it's a
Right,
life change.
right, and they can still use topicals.
Yeah.
That's that works.
Yeah. Right. Okay. So, what are some other common, uncommon conditions you treat successfully?
Well, anything that involves
Mm-hmm.
inflammation, and most skin disorders do,
Mm-hmm.
I've had success with. Some people say, "Well, did you ever treat this before?" And I say, "No, but I think I can help you." And
Yeah.
they want to know I've treated 100 cases.
Yeah.
But the truth is that the methodology when you're dealing with inflammation is really very much the same.
Mm-hmm.
So I had a patient call me with a condition. They had a child with lymphomatoid papulosis,
Okay.
which, when you hear that word lymphomatoid,
Yeah.
you know that there's about 10% that convert to lymphomas.
Right.
And there's some concern there, hundreds of bumps all over the
Mm-hmm.
body. And I wound up hearing the story, and I did a few things, made some improvements. And then I heard the story again. Actually, this was, I didn't even get to see them in person.
Mm-hmm.
And then I heard the story more carefully. I elicited some information, found out it was by the holidays, and it all came on with the sugar. And
Right.
I changed the diet dramatically, used some supplements. The next phone call, 95% better. They were recommended to go on methotrexate, which is, as
Yes.
you know, a cytotoxic drug,
Sure.
for 2 years.
Wow.
So I really feel that's
You
the kind of thing
saved
that
that
warms my
person.
heart. I can save
Yeah.
this poor
Yeah.
kid from
Yeah.
2 years of methotrexate. She would have spent the rest of her life dealing with this,
Liver.
with the possibility of side effects from that.
Please. Wow. That's great. Describe the kind of patient who is most likely to have a successful outcome with your treatment, and what might they have to do that is a challenge.
Well, the people who have the best results with me are, first of all, really motivated. There's not a
Mm-hmm.
question about whether this is a yes or no or what the priority is.
Mm-hmm.
And unfortunately, a lot of people are not so clear about their priorities. And they're also not so clear about the important thing I just want to mention is that I see skin disease as a symptom more than I see it as a condition.
Yeah.
So my perspective is, what is this telling us? What can we change? And how can this impact the person's life? So I
Yeah.
love to have positive side effects.
Right.
Person gets more energy, they run faster,
Headaches are
instead of
gone.
having negative, yeah, exactly. Leg swelling goes away. I've all these things that they didn't even mention get
Yeah.
better. And to me, that's really
Mm-hmm.
what it's about. So
Sure.
the kinds of
So the kinds of patients who
So the
might
kinds of
most likely
patients
respond.
then are ones who are first of all committed.
Mhm.
Second of all, can actually afford the supplements
Right.
and seeing me. And you know, if they can, if they, unfortunately, the government and the insurance will pay huge sums of money for certain medications.
Right.
Thousands, even tens of thousands of dollars, even more
Yes.
for certain medications. But they don't pay now for cognitive work. So spending an hour or more with a patient and being versed in 2 or 3 different fields and up to date in those things, they don't care about.
No.
And so it's impossible to do this on insurance unless somebody's feeding you money from
Yeah.
the back. So,
Exactly.
so
Shame, isn't it?
unfortunately, it's too bad. I think that there's going to be a day when this becomes recognized, when it becomes clear that there's some people who I can fix for much less money than the conventional way. And it's a small group, but
Yep.
it's a definite group, and that those people be paid for. But at this particular time, people have to be able to afford to do this.
Right.
And they have to be willing to give up favorite foods. Often it's the drink with at work or afterwards, things that they would crave. That's sometimes the biggest challenge.
Yeah. Habits, breaking them.
Breaking habits, breaking the expectations of their friends and their husband or their family who says, come on.
Right.
So those people who can make those changes, and the last one is, since I haven't found a magic way to do this, they have to take supplements, and that means taking a bunch of pills.
Right. Great. Great answer, Doc. So tell us about some of the more difficult cases you've solved.
Well, I remember once having a farmer whose scalp was always breaking out with pustules and inflammation. I mean, it was I had to treat him with steroids and antibiotics to get just to get him under control repeatedly. And then I found out that he was getting sprayed with the pesticides.
Oh.
And I started thinking, now why would the scalp break out with pustules and all this? And I was thinking, maybe the body has a response of trying to get rid of these neurotoxic substances so they don't go into that other fat-containing organ, the brain.
Yeah.
So I got him away from the pesticides, and I used a cleansing tea that came. You made a gallon of this stuff. It was really a potent cleansing tea.
Yep.
And he cleared up.
Amazing.
So,
yeah, I mean, it's amazing. You know, but it happens. I know you see it even more than that one case. You see it more.
and unfortunately, he confirmed that this was the case by his son had to do something for the neighbor, and his son, I think, sprayed again, and he got the spray on him, and he broke out again, and he cleared again with this. So the p-value, the likelihood that this was really doing it, increased tremendously. I wouldn't have done that experiment myself,
Right.
but he did it accidentally.
Sure.
So
Good.
that's an example of the kinds
Again,
of things.
Inside out, always.
Yeah, or recently I had a patient who came in. Now, sometimes it takes a long time to get acne under control.
Yeah.
But I had a patient who came in who had been having a lot of sugar and whatnot, and she had cystic acne all over her face. In a month, she came back. She was dramatically better.
Yeah. You know, I was speaking to someone just recently, and they were telling me about their daughter. You know, first year of college, very nervous, very anxious, nerves. You know, and she's broken out with eczema all over her body. Never had it before, and now so is that something that you're alluding to? I feel it is. You know, working with this child's stress levels, maybe for being the first year in college, and that. I mean, have you seen that? You know, and then would you work with that kind of a patient?
Yes. Stress makes a tremendous difference, and the more we know about it, the more levels we understand. So one of them is that the stress affects the immune system,
right?
But also it affects the digestive system. If you're stressed like this, you're running from the wolf,
right?
And you don't digest when you're running from the wolf. If you did, you would have been eaten by the wolf, or your ancestors would have been eaten by the wolf.
Exactly.
Right?
Yep. So answers for sure.
So so at many different levels, the stress is making a difference. And you have to learn to take that on. I mean, as we all know, when you grow up and finish school, you have to learn how to handle stress because it's going to be there.
For sure. Good. So what got you interested in inflammatory conditions and autoimmune disease?
Well, when I was in college, my dad's friend was volunteering at a little place up in Rye called Sloan Kettering.
Little place.
It was. It was
Yeah.
like, it's now a condo village,
Okay.
the place where that was. And it was a laboratory where they were testing all kinds of stuff that they could find and seeing if it would kill tumors. But there was one little laboratory in there that was doing tumor immunology. And I went and started volunteering there. And that was where I first learned about lymphocytes and cellular immune reactivity and tumor immunology.
Right.
And I started there back in '63.
Wow.
And my wife says not to say how far
Not
long
to say how
back it
far
was.
back. We said
Right.
it. It's
But
on.
anyway, that and from there I went to a series of different laboratories where I was studying cellular immunology and winding up at the National Cancer Institute. So I've had a long interest in the basic science behind this. And that I've translated into my clinical understanding of how these things work.
Yeah.
And it helps me see somebody's picture and pull it together in a way that I wouldn't have otherwise.
Yeah, yeah, so refreshing. I have to tell you that, with your background as a medical doctor, to be engaged in all these alternative methods and seeing them work so well for you, love it.
It's only because I had heard about them and I sort of believed it.
Yeah.
But when I did my work on immune recognition and saw how the equations could be so different than one would have imagined otherwise, in terms of one thing stimulating another thing as a response, I started to understand why those things made sense and knew that there was truly a science behind it. That science didn't become understood generally until almost 20 some odd years later, when people started talking about this in the New England Journal of Medicine.
That's amazing. It's great. So, do you see any common problems that affect people's health? And where do you think these are coming from? I guess
Well,
common
yeah,
things.
it's interesting. There are a lot of things. I call it a social disease.
Right.
We're eating 140 pounds of sugar per person per year in this country. That wasn't always.
Right.
We're exposed to a tremendous number of pesticides, of hormone disruptors in the plastics and the petrochemicals and in the things that we put on our face. We're exposed to maybe a different ultraviolet light than I was as a boy because of the breaking down of the ozone. There are so many things that are societal. We watch television. I wish I could get time to watch television, but a lot of us watch television on a regular basis, so we've had less exercise. Our whole way of living has shifted and is very different than it was 50 or 100 years ago.
Sure.
And these things all have their costs.
Yeah.
And so a lot of what I'm doing is just working against those damages.
Yeah.
And it's a social thing.
Yeah.
At some point, I hope that we begin to look a little more carefully at all of these things and say, is there a better way to do these things? Can we make our population healthier, more vibrant, more able to enjoy life more, able to produce more?
Yeah, for sure. I'm all on board for that. I mean, but with the introduction of cell phones and computers and all, I mean, we're going in one direction, we're trying to pull in the other direction. The world is thinking wellness, and the world is thinking let's prevent everything, and yet we come out with all these other things. It's such a crazy world.
It's true. It's true. And we have to constantly be looking to figure out how to do that better.
Yeah, right. Got to get a balance there.
Exactly.
Great, Doc. So you have any last comments before we wind up here? I know.
Well, I just wanted
about your book.
I just wanted to remind people about Radiant Skin from the Inside Out, because it's, even when I see somebody for an hour, it's hard to tell them everything that I have in a 300-page book.
Right.
And I think this will be very helpful for anybody who's interested in skin problems or inflammation in general. And I hope people begin to find ways to really lead a healthier lifestyle and be more vibrant. And I think a lot of aging is just accumulation of damage.
Yes.
And that can be reversed.
Yeah.
So
change your attitude.
Yeah, change your attitude and take your life in your hands and improve it.
Take charge. Great.
Take charge.
Doc, that was wonderful. Thank you for being on the show.
Thank you.
And thank you for being such an attentive audience, and we look forward to seeing you on the next show. Thank you.